Hello, my name is Madeline Jazz Harvey, and I'm an assistant professor of dance at Colorado State University. I am here today to share with you an ongoing process, the movement through motherhood research that began at the start of my pregnancy with um, an idea to chronicle this moment in time for myself and for my family in a way that felt meaningful. As a long time dance practitioner and former professional performer, I was adjusting to the idea of becoming a mother and the bodily changes I was experiencing, and sort of trying to understand how life was going to shift and change as a result of this exciting news. So I reached out to Dr. Zainab Bayramjan and was really grateful for a serendipitous response from her that led to just now over 2 years long partnership and ever growing expansion of our research. Um, Zainab and her colleagues created a pregnancy workbook, which she'll speak of later, that was several pages of guiding prompts and questions that I wrote written responses for, and then went back to that writing material as source material for choreography. The types of prompts that I chose to focus on within the choreography were those that were centered on sort of my emotional connection, my sort of perceived expectations and desires and hopes for the child that was becoming. And also looked at questions that dealt with the relationship between myself and my partner, and sort of how we viewed each other as growing into these new roles. This process ignited more dialogue, more transparent dialogue between my partner and me. It helped me to trust my own intuition a little bit more. It helped me start to build a connection and trust in my baby and their capacity to sort of tell me what they need. And so I felt like that was important work to share. So we began to develop what is now the movement through motherhood research. I aspire to kind of model lifelong learning and risk taking, and so I felt like this was an excellent opportunity to invite students along with me in this new journey and new line of inquiry.
I'm joined by the 3 dance facilitators who are students from Colorado State University's School of Music, Theater, and Dance. These are exceptional dance majors who exhibit excellence in academic and artistic performance. I'll have you introduce yourself and tell us a little bit about what this learning opportunity has meant for you as an undergraduate student.
Hi, my name is Abby Allison. I use she, her pronouns, and I'm a junior at CSU. I'm studying both theater and dance, and I was really interested in movement through motherhood because I've always been really interested in working with children, and I was really interested in learning about furthering my understanding of childhood development and the psychology behind the thought process of children, as well as the way how our mindsets as female presenting people have been affected by society. So it's been very exciting to be able to watch the development of our participating moms become more confident and connected with their bodies and be able to make a difference in how they perceive themselves throughout their pregnancy. In the future, I know I want to combine my love for children and performance in theater and dance. And I think this experience has given me more direction of how I might want to pursue further education or in what context I may want to work more along these lines, or how I want to incorporate the skills that I've learned in movement through motherhood in my own life, in my own motherhood, and in my own relationships.
Hey, my name is Maddie Kling. I use she, her pronouns. I am also a junior in the dance program, and I'm also studying human development and family studies. This movement through motherhood program perfectly combines things that I'm learning in my human development major and my dance major. For example, the movement activities, I got to apply emotional availability and expression and making sure the moms are open and connected with themselves, which is something I'm learning in my HDFS program. And I get to put it into movement and then teach it to these moms, which is skills I'm learning in the dance program. That is just one example of how movement through motherhood is furthering me towards my future goals, which include becoming a dance therapist. And it's been amazing to receive such hands-on support from Professor Madeline Harvey, and the scaffolding she provides has really pushed me forward.
Hi, my name is Madeline Cavanis. I am a sophomore at CSU, majoring in dance and health and exercise science, and my pronouns are she, her, hers. I've always been interested in the ways that dance can enhance various experiences and just a person's overall well-being. And before joining this research, I had never really considered utilizing dance as a tool during pregnancy and how it can alter the mother's experience and the connection felt with her baby and her support person. So it's been amazing to see the mom's willingness to explore this form of expression and just the ways that they will carry this experience forward. In my future, I would love to work with dancers as a physical therapist. And although this isn't directly tied to the study, it definitely is related to how dance can enhance a person's experience or help them heal. So that's how I would like to use this in my future.
So we start with pre-tests that are self-reported that look at prenatal emotional availability and emotional expressivity and mental health with anxiety and depression. These moms complete pregnancy workbooks that talk about mindfulness and questions about their family experiences and their pregnancy. And we have our dance interventions where we do movement activities that we've adapted that focus on nonverbal communication, developing creativity and vulnerability, expression, bonding with the child, improving mood, and overall well-being.
During body articulations, participants follow along, isolating faces, head, shoulders, arms, ribs, hips, and ankles. This activity is called This Is Me Today. Participants introduce themselves and their babies with gestural movements in order to create a gestural sequence.
During the name game, participants use their body to inscribe a prospective baby name on their belly and in space. The mirroring game allows participants to communicate messages to themselves and to their babies through the mirror, as well as finding moments of silliness to give positive affirmations and find vulnerability.
In the activity called baby-led moving, mothers are encouraged to bring attention to their baby. Mother allows the baby to initiate outward movements responding to weight, directionality, movements felt, recalled heartbeat rhythms, and so much more of the pregnancy experience. In the activity called release of emotions, moms use dance to express happiness, nervousness, excitement, frustration, and love, all emotions related to pregnancy.
In sharing the load, we focus on breathing with guided gentle weight sharing with the floor and the walls to allow the mothers a chance to think about extending the weight of society and the weight of the pregnancy onto something else.
In the last activity, Show Your Strength, moms form a gesture or movement to reflect their greatest strength as a mother. They're also encouraged to think about strengths they admire in other mothers or strengths they want to have as a mother.
For homework, moms are asked to choose a song they would like to dance to that is meaningful and connected to their pregnancy journey. On our next dance day, usually 1 or more weeks later, we revisit baby-led moving body articulations and transition This Is Me Today into This Is Baby Today, focusing on what baby might be experiencing in the womb. Participants are given a brief explanation of choreography and the choreographic process as it relates to the body, energy, space, and time. Moms are each sent into a separate Zoom breakout room with a dance facilitator and given 20 minutes to create their own pregnancy dance. They are given a choreographic score, which provides the outline for the beginning, middle, and end. At the end of their creative process, the moms share their pregnancy dances first with a dance facilitator who offers performative and choreographic feedback. For example, try extending your movements out a little bit further into your fingertips. Or, it's really nice when you hold this tableau. Can you hold that a little bit longer so that your audience can really see and interpret what you're doing? After the opportunity to share one-on-one, moms come back and share their pregnancy performances to their peers, a small cohort of generally 3 to 5 fellow pregnant mothers. During the sharing process, they perform first using only their bodies. Viewers take turns highlighting moments of interest, asking questions, or giving comments of encouragement and support to one another. The performing mother is then allowed to elaborate on her creative process and specific artistic choices she has made relative to her pregnancy. We conclude our session with discussion to allow mothers to sort of put into words what their experience has meant over the 2 dance movement interactions.
We also do emotional availability training with one of our students from the HDFS department. Our first cohort of moms combined the psychosocial and dance aspects. Our second cohort was just dance to compare observed emotional availability differences.
Hi, my name is Anne Kurleski Vandenberg. I am the research assistant under Professor Zeynep, part of the psychosocial arm for the Movement Through Motherhood study. The several questionnaires that are distributed to each of the participants when they enter in the study consist of several scales that we use as a pre-test for each participant and mother who enters. These include a demographics sheet just to get, is this their first time pregnancy, ethnicity, location, things like that. And then we have our emotional expressivity scale and our Edinburgh postnatal depression scale, our flourishing scale, our Hamilton anxiety scale, and those together work as a way to kind of measure where the mom is at before they enter the study and kind of see where they're at. And would be usually in their second part of their trimester, in their second trimester. After the initial email, we have several points of contact throughout the next several weeks. From there, I introduce myself and we have several phone calls that we talk about the pregnancy worksheets that are also attached in the initial email. Pregnancy worksheets are a condensed version of the pregnancy workbook that was designed by Professor Zeynep as well as Sarah Salo and other researchers that were kind of all aimed at emotional availability, emotional attachment, and mindfulness through your whole pregnancy. We condensed this workbook into a series of 3 sheets that are picked out questions from the workbook that talk about several parts throughout your pregnancy to spark conversation about attachment and mindfulness, including a mindfulness activity within the worksheets. Some examples of a question that would be on this worksheet would be, tell us about the first time you heard your baby's heartbeat. Tell us about when you found out you were pregnant and how you told everyone around you. And then get into more developmental questions of, what are 3 adjectives you would use to describe yourself as a mother or your baby or your partner, and kind of getting them to think and provoke reflectiveness within these worksheets. The phone calls then serve as a way to then verbalize and communicate and talk about the reflectiveness that goes on within the worksheets that each of these moms are answering. I personally very much enjoy these phone calls. It's a great time for me as a research student be able to connect with each of these participants and really get to understand where each of them are coming from and the ideas that they have as they're going through this pregnancy, as well as talk about struggles and hardships that they're facing during their pregnancy. I'm kind of talking about those and what that means for each of the moms. The EA workshop that takes place in the middle of each of these dance workshops, and they attend that meeting typically on a weekend, and we walk through about for an hour and a half of a PowerPoint designed by Professor Zeynep that steps and touches on each of the ideas that go around emotional availability. Where does the mom see herself connected to her baby? In what methods? How to practice secure attachment. What does secure attachment define as in the developmental world, and things like that. And this is just a great information and sharing session to have between each of the moms. The EA coaching session is the final part of our intervention on the psychosocial arm. We have a workshop that we use. So we start out with 4 questions, and we record these 4 questions. A few days later, we go back and do the EA coaching session. The post-test of 4 questions consist of tell something to your baby using words, tell something to your baby without using words, draw a picture of yourself and your baby, play a musical instrument, tune, or song for your baby, and tell the baby about the people they will meet after they are born. These 4 questions are then recorded, and then a meeting that takes place a few days later goes over the recap of these, and we watch it. And as we do so, we look for micro expressions within the mother. And through that several day period, it gives me, the research assistant, and Zeynep a time to go over these questions and kind of do some initial qualitative analyzing of the mother and her baby, looking for points of contact between her eye contact and looking down into her belly, the moments that she touches her belly, the ways the words she uses to describe and interact with her baby. All of these go into categories that we point out as high or low scoring EA. We then, in the EA coaching session, talk about these points that we saw within these 4 questions and answers that the mom gave, and speak to them about what was really great that we saw, what are some rooms for improvement, what are solid and really good practices that you should keep going in the postpartum experience, and maybe some suggestions of when you're thinking about your baby, try this, or giving examples and kind of guidance for these moms that have gone through this whole intervention. The coding that takes place after all intervention is complete consists of the mothers answering the same questionnaires that were distributed to them in the initial email, such as the Edinburgh and Hamilton, and we are then plugging these all into Quadralics, and then analyzing different responses and looking at different things that scored higher and lower, improvements or not. Also, we go through the post-test questions that are asked, the 4 that I have mentioned earlier, and we code for those. We have people that are specifically trained in EA coding. They will then go through these clips and they will analyze and score each of these. They use a scoring rubric that was designed with Sarah Salo, the other associate with us, and she has laid out several points and kind of on a scale. And so this scale is then applied to each of these post-tests and then kind of gives us numbers to work with. Several hypotheses that we are testing within this include whether the dance-only intervention works as well as the dance plus psychosocial intervention for improving maternal well-being and relationship with the unborn baby. These are kind of the ideas that we're testing between these 2 groups and seeing what correlations we can draw between them. For a student learning experience with the Movement Through Motherhood study, I couldn't have asked for anything more. I have been so inspired and and learned so much through my participation within this study. I have had the pleasure to speak with so many pregnant moms at this point that my idea of becoming a midwife has just only become more concrete and made me more excited to work with this population. I've also just gained an incredible amount of skills from interviewing to ethical guidelines, as well as now the whole data entry point and scoring and analysis of all the data that we have collected over the past year. This has been such an exciting and amazing experience that I've been able to have as an undergrad. I feel incredibly fortunate every day.
Hi, I'm Zeynep Berenjen. I'm a professor at Colorado State University in the Department of Human Development and Family Studies. I received my PhD from the University of California at Berkeley. These 3 things, emotional availability, attachment, and mindfulness, we call the 3 pillars of practice. And emotional availability refers to actual mother-child interactions that are going on, whether it's with the unborn baby or after the baby is born. And I'll describe what the different components of that are. And attachment refers to bonding, an enduring bond, an enduring affectional tie with our baby, whether in the womb or as a child. And mindfulness is merely a strategy that we use to experience and be present in the moment. And so we use that term and we do some exercises associated with being and remaining calm, non-judgmental, just in the moment, just being present. But the nature of that affectional tie can be so different and so variable, such that approximately 70% of the general population, general community population, no risk factors whatsoever, evolve and are able to nurture secure attachments with their children. Approximately 30%, again, of normal, normative, unselected community populations, even though they may be blending in with the general population, 30%, 30% are actually coming from and or raising their children in a less secure way. So it's a substantial population, 30%. Moving back to emotional availability as that additional pillar of practice, we describe that in 6 different ways. And those ways of describing the quality of the emotional connection or interaction between a parent and a child leads directly into whether or not that relationship is secure or less secure. Those different qualities that feed into emotional availability are a parent's sensitivity, a parent's structuring behaviors, a parent's non-intrusive presence, a parent's non-hostile presence. And then how do you tell you're doing well on the job? You look to the child side. The child responsiveness to the parent and the child's involvement of the parent being at high levels suggests that the parent is using those 4 qualities of emotional availability, which we call EA, emotional availability, EA. Those 4 qualities are high if the child is appropriately emotionally responsive and involving of the parent. When we look at the 4 qualities, sensitivity, structuring behaviors, non-intrusiveness, and non-hostility, those are the things that we are evaluating or assessing when we assess emotional availability, EA. And so basically, I've been involved for decades now in doing emotional availability work. And basically, when we first started doing this, there was no measurement system for evaluating the actual interaction between parents and their children that could feed directly into the security or insecurity of attachment. There was definitely early work by others, but the emotional availability scales were developed, early versions, probably 1987 with my dissertation, and then we kept perfecting it. And so we're now on what is called the 4th edition of the system. And it has really become the most commonly used way to assess parent-child interactions that are observed. And then you rate people on these qualities. And it became so heavily useful to people. And part of the reason is it emanates from a background in attachment theory and really feeds directly into predicting how securely attached a child will become. And security of attachment, you typically assess no earlier than 11 or 12 months of age. Whereas with the EA framework, we're actually able to assess at the get-go. And so for decades, we assessed it, sensitivity, structuring, non-intrusiveness, non-hostility. We assessed as soon as babies were born. But much more recently, we've actually gone with Finnish colleagues to developing a prenatal version of measuring emotional availability. So even when moms are pregnant, we're able to actually assess their emotional availability toward the unborn baby. In the psychosocial component, we teach them about these different components of emotional availability in an online workshop. Training them in these terms, we share videotapes with them of other parents interacting with their children, and we interactively discuss how we might evaluate the interaction so that they get a sense of both how to think about emotional availability in relationships, but also how to think about attachment. Like, is this a secure attachment or is this a less secure attachment? And one of the really nice things about the program is that it's not static. So when we look, we might say, well, these behaviors look like they would nurture a less secure attachment. But then we show after the program videotapes of parents who have gone through the program and now they're nurturing a secure attachment. So these are not static things, but they're based on training, which is what we do. So like the most recent example I can think of was with a mom in her third trimester. So we want to do this in the beginning of the third trimester after there's the mom feels the baby move, is when we want to actually film that prenatal EA. And basically, when she was talking about her unborn baby, she seemed to really speak about her in a as a separate individual. She spoke about her with respect, and she was very connected, but yet saw her as a separate person already. And so in the coaching, I pointed that out to her. For years, I've been doing emotional availability research. And then more recently, I would say since probably 2005, we've been doing strictly emotional availability interventions. And one of the most challenging things that I've found is how one changes the so-called affective procedures of a parent. Those things actually emanate from our families of origin. They're things that are at very much of an unconscious level. We don't know that often we're frowning. We don't know sometimes that we're always smiling. I think for parenting, it's a much healthier thing to be conscious of a lot of the things that we're doing, because we all have, whether it's from our father or our mother or aunts or uncles or siblings, there are things that we all want to improve on. So conscious parenting is a really powerful thing. And the affective procedures have been what I have seen as the most challenging aspect. We can teach a lot of things in the psychosocial component, and by showing through video playback of others' interactions, we're able to bypass quite a bit in that we're actually able to talk about the affective procedures of others, which is an important lesson learned. But the actual expression of some of these things really take practice and getting that to be a part of who you are. And so that was part of the reason why I was so excited when Madeline had this idea of movement through motherhood. And so I think that regardless of how we talk to our children, which starts prenatally and then continues through all of the child rearing years and beyond, there is a nonverbal level of communication that actually precedes a lot of the verbal communication, and that continues in parallel throughout development. And how to make that as expressive in the right ways, how to make that consistent with the verbal, and how to make that as rich as possible so that our babies get that. We also are sensitive to certain situations where it may be especially useful. So we're really interested in improving the mood of women during pregnancy, discussed in research studies that postpartum depression, while it's very common and very commonly discussed now, prenatal depression, anxiety is also extremely common and not as often discussed or acknowledged. But movement through motherhood, we feel, because of it not only just being exercise, it's actually gentle movements as much as the mother is able to, chooses to engage in. Those gentle movements have, obviously, because of its dance, there's an aesthetic quality, creative quality to them. And as an ultimate goal, we do want it to be as a way for improving prenatal and postpartum mood and helping with mood disorders.
Related to the dance component, dance therapy is the use of psychotherapeutic movement to integrate cognitive, social, and physical aspects of development. Led by a dance-trained facilitator, dance therapy typically involves integrated sessions including dance technique, social skills, self-esteem, coping practices, and emotional expression. Our study differs slightly in that we have a standardized set of movement activities that remain the same between cohorts. One researcher in the field proposes dance as a potent healing tool because it creates community between individuals going through similar experiences and allows needs to be expressed with validation through a mind-body connection. Another study found that in different situations, movement increased different aspects of functioning. For example, dance improved concentration for individuals diagnosed with ADHD while aiding social skills for patients with dementia. The purpose of our study, Movement Through Motherhood, is to understand how pre-parenting dance psychosocial intervention may help improve expectant mothers' moods and feelings about their unborn baby, as well as their own emotional availability in preparation for parenthood. Dance therapy has the potential to improve the proposed factors, and there is already developmental research that support the foundation for our study. For example, prominent psychiatrist Daniel Stern and a field of other scientists refer to the mother-child bond as a dance, using the metaphor to describe the synchronous beauty of such interactions. A postpartum dance movement study found that the mother was able to embody her infant's expression, thereby improving her attunement and attachment. The Movement Through Motherhood project corporalizes the attunement dance as a tool for coping and healing, enhancing awareness and listening, building trust and empathy, fostering community, and expressing development of affectional bond between mom and baby. Furthermore, we know that pregnancy brings tough emotions associated with past, current, and future attachments that are not easily spoken. Dance gives a nonverbal way to access and express these emotions. Movement Through Motherhood provides a community for mothers to explore their understanding of themselves and their relations to others. We ask participants to speak through their bodies to heighten awareness and listening. Participants draw from their own experiences and cultures to create and perform dance gestures, phrases, and sequences. In this way, the mothers connect to themselves, to their baby, and to their community, providing a safe space for expression and attachment.
Dance movement activities were originally designed for expectant mother and a support person. The information we share today has been adapted to just mother and baby interactions. We want our research to be as inclusive as possible, and felt that in requiring a support person, we might indirectly be excluding individuals who do not have access to that support. We're now in the process of a third adaptation to the set movement activities that will account for interactions postpartum for children aged 0 to 14 years. In our future model of the design, we have discussed narrowing the collection of questionnaires to the Edinburgh Depression Scale, the Flourishing Scale, and the Prenatal EA. We also found through this process that it is important that we assess observed prenatal emotional availability at the pre-test stage in order to better understand how the movement interventions are impacting the physicality and physical expression of that emotional availability. So we will be adding that to the next stage of our research.
While helping facilitate dance movement sessions, I have observed that mothers without dance experience have been somewhat hesitant in their abilities when beginning sessions, but they find confidence and comfortability throughout. It has been amazing to see their growth and the development of their own individual movement styles. Some themes I've observed through the movement sessions include mothers increasing comfortability with creating their own movement, ease of anxiety, growth in self-confidence and excitement, as well as incredible use of imagination and physical and creative experimentation. Additionally, mothers were willing and eager to provide positive feedback for other mothers while sharing movement, which established a supportive environment that nurtured creativity.
At the end of our sessions, we always ask our mothers for feedback and time for reflection. And one of the things that is a very prominent theme is the community that the sessions have created amongst the moms. One mom said that it was really nice to kind of have a community of mom dancing movers, just to watch them and experience it at the same time. They found a lot of comfort in their bodily changes as the baby grows and have found ways to let their baby guide their movement. Another quote says that I really like just sitting and kind of intuitively creating and just kind of let your body do more of the talking. And you notice taking the time to connect. They found times to focus on themselves and have self-care, and also really appreciated the time of connection with their baby. They explored physical expression. A lot of moms had never even considered physical expression as a way of communication. One mom said, so if her baby is having a hard time verbalizing or anything, we want to introduce the concept of using your body to say how you're feeling too. They created tools that they want to use in the future during labor or postpartum with communicating non-verbally with their baby or with other people in their relationship.
As this research is still actively in progress, we have not been able to do all of the coding and data analysis. So I look forward to bringing more information to those who are interested in attending any chat and Q&A opportunities during the conference.
Thank you for allowing us to share our current and ongoing research with you.